Okay, good afternoon. Can you hear me?
Yes, po, we can hear you.
Can you hear me?
Yes, doctor, we can hear you.
Okay, let's just wait for the others. Could you kindly tell them to join in?
Following.
Okay, I think we could start. Okay, so for our lecture for this afternoon, we talk about public health. And I have asked you to view these slides prior. So we would just be looking at it at an experiential point of view. So for you, what is public health? How does public health affect your lives? And how do you think its role would be in your lives as you become medical doctors? Anyone?
Doctor, public health is the science of preventing diseases and promoting health among the communities. And for a physician, I think public health plays an instrumental role in his life because the primary role of a physician is to ensure that the community is healthy.
Okay. And that is changing the paradigm from a hospital centric point of view towards prevention of illness or prevention of disease. So
Okay.
why, as a doctor, why would you spouse that? Or there would be less patients.
Doctor.
Hello? I, you want
Yeah.
to say something?
Yeah. Another angle. We can more like say is a health that has to do with health concern of the government, such as government regulation and support, in
Okay.
terms of hygiene and epidemiology of diseases and prevention.
Okay, you look at sanitation, you look at hygiene. Okay, so in India, what's the problem? Because of your population, solid waste production is a problem, water pollution is a problem, production of air pollution is a problem. And this, if it's not controlled, what? It will further pollute and degrade your natural resources and the like. Although it's important to say that per person, per capita, you are not the number one producer of pollution. However, with the sheer volume of the Indian population, that catapults you to number one solid waste, water, and air pollution producer. Okay. So this is your clinical medicine, and your other subjects will teach you this: the how to diagnose, how to treat and prevent disease, provide comfort, relieving pain. We also do that in community medicine and preventive health. But what it does focus on as public health physicians would be more on strategies that promote health and prevent disease. So before, again, your concepts in your first year medicine, before disease becomes a problem, we try to prevent it. So we look at your public health laws. We will look at public health laws and policies at a later lecture. How to assess and monitor problems, and delivery of essential healthcare services. So this delivery of essential health services kinda became a problem when the coronavirus set in, especially in the initial stages of the lockdown, etc. These essential health services, some failed to deliver these services, hence problem with various aspects of our lives. For example, family care planning services were hard to access during the initial part of the lockdown. So what happened? So March, so come December and January, there was increase in the number of pregnant patients due to the lack of access of family health care services. So those are the things that you have to consider. Immunization services, breakdown, services for non-COVID patients, etc., etc. So those are things that we experienced for the past year, such that public health should always be in the forefront. The epidemiologists are the front with regards to looking at diseases of public health importance. Prior to the pandemic, what do you think are the diseases of public health importance before the coronavirus became the star of the show? So for example, in India, what's the most common disease that presents a problem in India?
Dengue fever.
Malaria,
Malaria, okay,
TB.
Dengue fever.
yellow fever. So, and you will see this, remember, in your sustainable development goals. These are the diseases of public health importance such that it was mentioned in the SDGs and the MDGs. Okay? So, this one would be the definition of your public health: sanitation, infection, education of the individual, organizing and developing machinery. Okay? So at the core of it would be your epidemiologist, and this would be organized community efforts to prevent disease and promote health. So for example, using the coronavirus as an example, what would promote health with regards to coronavirus and preventing your pandemic from further propagating? what were the policies that were eventually put into place?
Max and Shield.
Making them mask compulsory for everyone.
Okay.
And also the distance, one specific distance was given,
Okay. Mask, social
and
distancing,
no
wearing of
public
mask,
gatherings.
no public gathering more than 10, more than 25 in open spaces. What else?
Also, the some educational, all the educational institutes were
Okay.
closed, so there are no gatherings.
பென்னு
Yes.
சூப்பரா இருக்குமா?
Religious institutions, entertainment solutions, educational institutions were
போட்டுமா?
closed. Okay.
நோட்டு.
So these are all to prevent, short of a total community lockdown, these are to prevent transmission. Okay. So you see the initial policies that governments
பென்சிலா?
put into place to curb the pandemic. However, it is sometimes it's not working. There's a second surge. In the Philippines, reproductive rate is at 1.66 for March. Could you mute?
பென்சில் பாக்ஸ். சித்தி கால் பண்ணவே இல்லை.
Okay. So this is the framework. So it encompasses all activities. So from the formal and informal sector of government, private and voluntary. All should work hand in hand for the benefit of public health. So mission, it would be to fulfill society's interest in assuring that conditions of the people can be healthy. Okay? So these are the responsibilities. So we failed in responsibility one, prevent epidemics and the spread of disease, protect against environmental hazards and environmental disasters, which again is also a collateral damage of your epidemic, pandemic, coronavirus. Imagine in India, if one is to wear one mask per day with a population of a billion people, that would be 7 billion masks per week, 365 million masks a year. So you imagine the additional solid waste that the earth would again bear for the year or for the next 2 or 3 years. And again, your environment will take a hit. Again, prevent injuries as well. Okay? Encourage healthy behaviors, mental health. You know what is good for you and what is bad. Disaster response and assisting communities in recovery and assuring the quality of health services. Okay? So at the end of this lecture activity, I have assigned an activity. So can someone share what what they did for the activity that I asked? What did you choose to do your activity on? To have examples of your 10 essentials of public health. Let's take 2 or 3 examples. Okay? So it's nothing new. So from the start, Hippocrates has said, even early philosophers have said that you have to be one with your environment and your society to be able to have a healthy society and to provide good health services. Okay? So why do we have to care as medical doctors? Again, also it's our duty and responsibility. So it would help care for our individual patients, and help improve legal, financial, and social environment that we work in. Okay. So they go hand in hand. Services for individuals, frameworks, cost effectiveness, using it in clinical practice, health promotion shapes the direction. Okay. So it would be in the state and the local government to provide help for the people. Okay. Okay, we have our core functions. You have your assessment, policy development, and assurance. Okay. So we go to the 10 essential services of public health. Okay, anyone who wants to share their activity? So at the end, I ask you to think about a current public health problem faced by you and take that public health problem or issue and think about how the 10 essential services of public health can solve that problem. What public health issue do you want? Do you want your coronavirus? Let's take it one by one. Okay? So, monitor health status to identify community health problems. So, with the coronavirus, how do we monitor health status to identify community health problems? How do we do surveillance? Anyone?
The best place you can start from is the hospitals. You ask the hospitals for information because it's more. I think that's the best place you can get a reliable information from, rather than doing a survey that would requires a face to face.
Okay. We look at the number of cases per day of coronavirus. We look at the clustering of the cases. If there is local transmission, what community would have the um, highest cases? What kind of variant? Where did they have travel history? And the like. Okay? So that is for monitoring health status to identify community health problems. Next would be diagnose and investigate health problems and health hazards in the community. So this outbreak, you have your outbreak investigation. You would look one by one where it came from, etc., etc., to look at different perspectives with regards to community transmission. Okay. So inform, educate, and empower people about health issues regarding coronavirus. How has the government proceed with this essential part of public health? How did they inform, educate, and empower the people?
All started with lockdown,
Doctor,
local news.
News, okay? They have released infographics, etc.
like doctor,
With
particularly in India,
lockdown,
like there used to be a pre-recorded message. Like if you have to make a local call to anybody in India, so you used to listen a pre-recorded message, making awareness about how we can deal with COVID-19.
Pre-recorded message. Oh, before you are able to place a call, they would have something.
Yes, doctor.
They would ask you to hear something.
Yeah, like they
like
got
the
Oh,
into
same
a
thing on the
famous
Shopee app.
Bollywood
Whenever you
personality.
goes on YouTube, they give you the Shopee video like that, an intro before you move on to watch
uh,
like that.
it's just like the Shopee. Before you get to the
Yeah,
app,
advertisement.
they say you something. Could you give me a recording of that if you have in India? I just want to hear. I'm curious.
Yes,
if
stop right
someone
now.
if someone could kindly uh
My phone attack. The new year brings a fresh ray of hope in the form of COVID-19 vaccine. The vaccines made in India are totally safe, effective, and with good immunogenic response against COVID-19 disease. So trust the vaccines made in India. Do take the vaccine at your turn and do not believe in hearsay. Remember, dawai thi aur kadai thi. Even after taking the vaccine, continue to wear a mask, observe physical distance of 2 meters, and regularly wash hands. For more information, visit www.mohfw.gov.in or call National Helpline number 1075.
Okay, that is
I,
before you place any call.
yes, doc.
Yes,
This
yes,
is
doctor.
after we got the vaccine, and before the vaccine, we used to have a message by a famous personality.
Amazing. But you eventually will get sick of that if every time it will play, right? Anyways, but that's how you are able to inform. That's like us. We repeat it over and over for you to remember. That's why there's pre-recorded and you have live sessions. You repeat again and again. Okay? Inform, educate. How do you feel that you are empowered about health issues? What is the definition of empower for you? I know we haven't had community organizing yet, which we will discuss empowerment. But what is the definition of empowerment?
Doctor, empowerment to me is that I have a proper awareness about the issue and I am able to follow all the guidelines and I'm even able to educate my friends and neighbors about the various guidelines which are needed to be followed.
Empower is having control over your own lives. So, with regards to coronavirus, you inform yourself, what is this? It's a virus, it's infectious. This is how I cannot contract the virus. This is how I can protect myself and my family from the virus. And you even mentioned sharing it with your neighbors, community on how to do about things. So that's having control over your own lives and producing solutions for your own problems. Okay, good. Mobilize. We're going ahead. We're getting larger. Mobilize community partnerships to identify and solve health problems. So, what did the community do? For example, in your particular community, what were the things that were done to curb your coronavirus and other health problems?
We have this lockdown going on still in some parts of the country, and then schools have been started, but then there's a distance between the seating arrangement. So there's actually one student per a bench, and then exams are being conducted online for most of them.
So, you have
And for
resumed school in
yes,
India?
some
Some.
some schools have resumed.
Doctor, even in the schools in India, only high school students are being allowed. Like those students of
Yes,
11th and 12th standard, only those are supposed to go to the school. And even their proper social distancing is being followed. They're using hand sanitizers. They are supposed to enter only with a mask. Otherwise, there is no entry.
Lockdowns are also part
yes,
of
doc.
community partnerships. Not
Yes,
going
doc.
out when you don't have any essential business outside. Or for example, if someone is buying out, you you look at other people's needs as well so that only one person will go out. Those are things that you could do. So policies and plans. So we have enforced policy, social distancing, mask, face shield, lockdown. So these are different policies that arose because of the coronavirus pandemic to protect the individual and the community. Okay. So, of course, you have to enforce these policies, laws, and regulations that protect health and ensure safety. So, of course, with enforcement, there would be corresponding fines if you don't follow. So, for example, in the Philippines, in the car, even if you're in a private vehicle, if you are more than one person, you have to wear a mask. Okay? Fine would be 1,000, 2,000, 3,000, and revoking of license for first, second, third offense.
Same
Okay?
here, ma'am. Same here. Uh,
Same there.
anyone who is yeah, anyone who is driving the car, if he's alone, also you have to wear the mask, or else 1,000 rupees fine. I have been fined for that.
1,000 rupees. That is
Yeah.
like 1,000 pesos here,
No, ma'am.
No, I
Around
don't.
700 or 600, maybe something like that.
roughly. Okay. If you're alone in the car, you could not wear a mask.
Yes, ma'am. Yes. In few
But if
states,
you're
in
more
my
than
state,
one, same. Yeah.
it's like that. I know in few states it's the rule. In my state, if you are alone, also you have to wear the mask.
Okay.
Um,
So, depends on the state. So, like what I've mentioned, there's federal for the whole country and state, local for a certain locality. So, more often than not, it's local. You have your ordinances, you have your laws that would guide you. Link people, personal health services, and assure the provision of health care when otherwise unavailable. So these are your insurance programs and welfare centers. So you have to have your insurance. So your senior clerks were asked to procure for health insurance prior to joining the clerkship rotation once it restarts. Of course, we have to have assure a competent public health and personal health care workforce. So given that coronavirus is a novel virus and it's just been with us for a year, you would see a lot of webinars here and there conducted by different societies to update their workforce, their societies with regards to how how to update. So with any disease, be it in IM, pediatrics, obstetrics, you will look at coronavirus and how it affects the disease and how your disease affects your coronavirus. Okay? So those are trainings, you read your journals and the like. Evaluate effectiveness, accessibility, and quality. So we have to evaluate if our interventions are working. So for example, would lockdown as an intervention be working? Would your social distancing, hand washing as an intervention be working? How many percentage? So I would I love to compare your mask and face shield usage to your family planning interventions. So remember your concept of typical use and perfect use with regards to your family planning intervention. Let me remind you, your typical use is what an average person would do with regards to, for example, using pills or condoms. Perfect use, for example, pills, if you do perfect use, that's close to 99% failure to become pregnant. But when you account in people factor or that's typical use, the effectiveness becomes lower. So for example, wearing of mask, what do they say would be the percent effectivity of preventing coronavirus if you wear your face mask?
If both the persons are wearing, 95%. If one
Okay.
person is wearing, it's 50%, ma'am.
Okay, so they have percentages as high as 90%. But that is assuming that you have perfect use.
Yes,
And
ma'am.
what are the examples of imperfect use in face mask or face shield? Face mask that would have your noses still exposed,
Yes, ma'am.
reusing of face mask, bringing down your face mask so that you could be heard speaking, bringing down your face mask so you could eat, putting it on the table, etc. Face shield, wearing it like a visor and not like a face shield, or wearing the face shield backwards. I've seen a lot, and sometimes I do correct, but remember, you have to evaluate effectiveness, how accessible. So remember, your face masks and face shields, initially, that's why prices were very high because supply was greater than demand. A box of face mask which originally costs just 50 pesos per box at the initial stages of the coronavirus reached 1,400 pesos per box. But I remember buying that because we needed to have that face mask, even if we knew that it was overpriced. Okay? Quality, of course, that speaks for itself of your interventions. Of course, research for new insights and innovative solutions to health problems. So hence the race for the development of a vaccine. Okay, so which would have different efficacies, would have different solutions. One is a live vaccine, one is mRNA, one is from a fetal abortus as a vehicle, etc., etc. But research is very important in any public health endeavor. Either research on the ground, that is your surveillance, or research for new solutions. Okay? So this is the example. So any disease, you could come up with an example and apply the 10 essential concepts of public health. Okay? So be able to know how to discuss public health using different public health problems that we are facing and apply the 10 essential services of public health that could solve the problem. Okay? Any questions with regard to the basic concepts of public health? You will see that with this pandemic, public health has been pushed to the forefront of different issues with regards to controlling this global pandemic. Okay, and you will appreciate more the concepts that we will learn for at least for the first 4 lectures of this semester. All right. So if there are no more questions, I will not leave you long. You I would ask you to submit your um activity um how through your MS Teams, right? I will place a notebook so you could place it there. Okay? Upload it in your class notebook. Okay? So it will be due until Friday and until Tuesday next week. So um do you want it by groups? If you have group, you could do it in groups of 10 so that it would be less. So please try to make use different health problems. Okay? Any questions? So if there are none, you may leave this call. Okay?
Doctor, how are the
Yes.
groups supposed to be made? Are they random or you want it attendance wise?
You could choose your own.
Okay, thank you.
All right.
Please make it alphabetical, please.
Okay, make sure
Alphabetical.
that you are part of a group. If you want, you could do it individually. If you don't want to work with others, it's okay.
Please alphabetical, please.
Alphabetical.
Yes.
Your classmate is requesting for alphabetical.
Yes, ma'am. Can you
Are
please
you
do it
okay?
alphabetically so that no one has any
Alphabetical is
problem?
alphabetical is also fine with me. So it's
Mother, one
all right.
second. Mother, we already do have a PMCH group.
Oh, if you have a PMCH group, that's fine. Use
Yeah.
that. All
Okay.
right. What PMCH group is that?
I think we do have for the research last year.
The research.
Yeah, we can
How
reduce
about
the number of participants and we can add some more if we want.
so that's not alphabetical.
Yeah, that's not alphabetical, but if if students are left over, they can go join the other groups, which is having less participants.
Please make it alphabetical, please. Alphabetical. Just
Okay, then fine.
new
It's doctor's
group,
wish.
please.
Is that alphabetical is more good because
Alphabetical's good. Okay.
we got a few more new students, so it will be
Yeah.
hectic to add in the same group.
Yes, yes. Please take into consideration that you have your PSWD classmates. So, for fairness sake, since what do you call this? You are not physically present with each other, so that it could be clear. Do you have a list of the students already?
Yes, for
Okay. So I will leave it to you. Make sure everybody has a group that is my one request. Okay? Whichever way, I will leave alphabetical and make sure no one is left behind. It's hard because just a few of you are enrolled. So I don't have your whole list. My list is just 18 students practically. So um, just make sure that everyone is accounted for. Okay? Any questions? Any concerns?
Ma'am, we are not able to join the PMCH group on MS Teams.
You're not able to join? Your
No,
perpetual
ma'am.
email is not there yet?
No, ma'am, it's there.
I will look at the requests again. So, I just added you. I think I added you,
Okay,
but
now.
I will check again. Okay?
Okay, now.
I think I did not give you the class code. I added you one by one. All right. Just tell me anyone who is not included. Course it through your LO and ask to be added. I will add manually. Okay? Any more questions? So if there's none, you may leave this call. Thank you. See you Tuesday.